There we go. Well, hi, Cary. Um, Thank you for joining us today. This is Dr. Peter Tsai with Aortic Warriors, and we have Cary Yurk all the way from Hong Kong. Cary, thank you very much for being part of this interview. So, Cary, without me saying anything or ruining the surprise, please tell us what happened on that fateful day.
Well, thank you, Peter. It's a privilege to be here and to share my aortic dissection experience with everybody. And this event occurred in my life on around 10:30 p.m. on the evening of December 7th, 2014, ironically Pearl Harbor Day. Um, I was living by myself at that time and was watching the news, cable news on television, when I suddenly got dizzy. And almost simultaneously, I felt, not sure, somewhere in between a pounding sensation or a kind of a stabbing sensation on the left part of my chest, and at the same time I completely lost muscular mobility control, and I just slumped down on the floor. I didn't fall or hit my head, I just slumped, but I had very, very little feeling and absolutely no muscular movement from the waist down. It was like dead weight at that point. So that was essentially what happened at the beginning. There were no warning signs. There wasn't any kind of preliminary pain or something that gave me an idea that, wow, something's going really wrong in my body. I need to call emergency. It just happened, and as I said, those three components happened almost simultaneously. So what I did, I had my good old reliable cell phone and called. In Hong Kong, our emergency number is 999, and told them what I thought I was having a heart attack. And I said I needed an ambulance to come and take me to hospital. The problem was that evening is that the night watchman in the building, residential building where I live, often goes up onto the roof to sleep. And so the challenge for me was to use what strength I had in my arms and shoulders to drag this dead weight. And I was pretty heavy at that time as well, to open two doors to my flat and get to the elevator in the corridor of the third floor where I was living. And that was a huge task and challenge for me immediately, and still regain consciousness and keep alert and keep pressing on. I was able to do all of that. I had my phone, my door keys, and my wallet with my Hong Kong ID card. That was essential if I was to get to hospital. And I got as far as the hallway, and then I completely lost any strength that I had. I was just laying on the hallway corridor floor, head down, and I started hallucinating, and I was hearing all of these kinds of laughter and voices saying I was going to die. And I remember just saying, no, I'm not going to die. And I kind of cried out to God in my circumstances, which I think probably would be natural for a lot of people, however you perceive God or spiritual being. And I said, I don't want to die. And honestly, and this is the actual experience, within 10 seconds, clear at the other end of the corridor, it was so late at night and I was losing blood so quickly, I didn't have the strength to cry out loudly so people could hear me. But a young Filipino lady suddenly came out of the other end of the hall where all the lights had been turned off. And so it's like she was walking out of the darkness, just smiling. And I was on the floor, and I lifted up my phone. I said, "Help! I'm having a heart attack. I'm dying. I need to get down to the ground floor. Help me! I can't get into the elevator. I can't stand up and press the button." And she didn't say anything. She just smiled. This very small woman dragged me into the elevator, took me down to the ground floor, and sure enough, as I had known, the watchman was not at his post where he should have been. And so I sat there, and I would say probably within 7 to 10 minutes, the paramedics arrived, and she went down and let them in. And of course, there were 5 of them, all Chinese, and it checked all my vital signs. And just as they were about to take me to the nearest hospital, they put me on the stretcher, and the lady had been standing there the whole time. And I wanted to say thank you to her, and as I turned my head, she vanished in front of all of us. Now, you can take it for what it is, but this actually happened. This is a fact. This is not something that I was hallucinating. And matter of fact, for 15 to 20 seconds, all 5 of us, 6 of us, the 5 paramedics and myself, were in kind of a psychological shock, as if we had seen something that was just so beyond reality, we didn't know how to read it. But finally, the captain got his senses together and said, "Hey, we need to get this guy the emergency right away. Right. We don't know what this is all about, but we got to focus on our mission." So they kept me, kept monitoring my vital signs on the way. Fortunately, the hospital, Rupture Hospital, was very close to where I lived, so it was not a long ambulance ride. They took me into ER. I answered all the questions, got admitted. They put me in for observation. And as so many people realize, that the first thing the first line staff at the hospital in emergency will think about is that I'm having a typical coronary related heart attack. And so that's what they were looking for, and they assumed that, and they gave me, I don't know how much the dosage was, but they injected me with aspirin, as you well know. The purpose was to increase the flow of blood before the artery that they were assumed was plugged up, completely closed. Then that would be it. That would be curtained. So they were trying to lengthen my life and then put me under observation. Of course, in fact, what they were doing, they were killing me. Because, as you know, with the aortic dissection, after the middle layer or the disengages and tears in the aorta, then that creates the false lupus.
Lumen.
And
yes.
Lupus. And that then the blood is going in the wrong direction, and so that's what we just normally know as internal bleeding. And I'm losing blood internally. It's not going to the right place, or at least not all of it is going to the right place where it should be going. So they did further monitoring, and they were going to prepare me for surgery at that hospital, but they realized they didn't have the cardiologists on hand, a complete team to do what they were supposed to do. They did a further CAT scan, and then they discovered that it was an aortic dissection. So then they quickly had me transferred to Queen Mary Hospital on the other side of Hong Kong Island, which is known to be a very reputable heart public hospital, very successful in dealing with people with heart problems, and particularly heart attacks. So I was transferred there and given after the questioning, they did an MRI on me, and they gave me the anesthesia, and I was induced into a very deep coma without any guarantee that I would come out of it. And so in the meantime, my two grown daughters flew out from London and from Sydney, Australia, to see how I was doing. And the friend that I'm living with now, a Chinese friend who was my contact person, because I have no family living in Hong Kong. I'm a single man, older and divorced, actually. So he contacted my two daughters who flew, and they were told by my surgeon, Dr. Flora Jung, that it was very unlikely I would survive. And they suggested that they see a spiritual counselor and maybe prepare for my funeral arrangements. So that was the situation. But so I had open heart, a 9-hour open heart surgery where the thoracic section of the aorta had completely torn through, and they repaired that, grafted it back, and then 2 days later they closed the wound, sewed up the wound. Well, of course, because they had to open the ribs, they had to rewire and fuse the ribs back, and then close the wound. And so, fortunately, on the 4th day of my coma, I woke up, and without seemingly doing pretty well. Now, the other point to make was this, that during these two surgeries, I had to receive 10 pints of blood. So there was a lot of blood lost. So I had a complete blood transfusion. But my situation is that I have O negative blood. And O negative is very rare anyway, and even more rare among Asians. And since Hong Kong is in China and predominantly 98% of the population are Chinese, you know that, and Hong Kong has a population of about 8 million, and they had the hospital, Queen Mary Hospital, had called the Hong Kong Blood Bank to get as many pints as possible. So they had 8 bags.
Oh, wow.
Of O negative. So I had to receive 2 bags of O positive. And of course there were risks involved, but fortunately, once you understand what's going on, an O negative blood recipient can one time receive O positive blood without the antibodies reacting and rejecting the blood. So the Rh factor is extremely important. If this were to happen again, I would not be able to repeat this. I could either die or have severe liver or kidney damage as a result. Matter of fact, they were prepared for me to be put on dialysis. Actually, even after the first time, they weren't exactly sure how my body would react. But wonderfully, it did accept it. And the only thing that The only side effect that I had is that this whole arm, my right arm, turned discolored into a very deep purple. I think, why it was just this arm from here to there, I have no idea. They didn't really explain that to me, but within 10 days, my skin returned back to normal, and it was fine. That was the only side effect that I had because of having to take two pints of O positive blood to complete the blood transfusion that I needed at that time. Of course, at the same time, my hemoglobin levels had dropped immensely, and so I would eventually have to, in my rehabilitation, have to receive another bag or pint of O negative blood, which did come, thankfully, a couple weeks later. I was in the ICU of Queen Mary Hospital for about 10 days. I think the worst thing about that was the fact that I couldn't drink anything. And I tell you, I never understood what it meant to be thirsty until I was in that experience.
Wow.
And the most that they could do, and it wasn't until the last 2 or 3 days, is just take that's kind of a wet wipe, but with real water, and just put it to my tongue and just suck the water. So I got out of ICU after about 10 days and was put into the regular men's ward for heart patients for initial recovery. They did an initial assessment on my semi-paralysis, and they said that maybe I would be able to begin the stages of learning how to walk in about a year. And they found that the Rupture hospital, where I was taken to the first time initially, where they misdiagnosed what had happened to me, but they have a very good physiotherapeutic program. So I went back for physio rehab to Rupture, and they really worked me like everything, but within 7 weeks, I was walking around normally through all the ward where my area was. Of course, I had to begin the whole process by just learning how to sit up, learning how to lift my feet a little bit, and it was agony. Just these very early things that we take for granted, movements, body movements, leaning forward, being able to move my legs from a flat position on the bed to sitting over the bed with my legs down, and then getting off the bed and holding on to a chair, and then a walker, and then a 3-pronged walker, and then or a 4-pronged walker to a 3-pronged walker to finally the cane. But by 7 weeks, I was out of the hospital. I was discharged on the 23rd of January, 2015, and then a week later I went back to the hospital for a assessment to see if I needed further physio rehab, and they had a whole series of different kinds of tests that I did, and they said, "You're fine." And actually that day I had walked with my cane to the hospital about 2.5 kilometers. Wow. That in and of itself showed that I was already mending quite well. And then within three months, I was able to walk without the cane, take public transport, buses, trams, subway trains, all around Hong Kong, and my mobility was fine. So that's basically what happened to me, what I experienced in my very early stages of recovery, to the point where I seemingly was able to have a fairly normal life.
Well, that is definitely a pretty amazing story. From paralysis to learning how to walk again, and you even remember every step from the 4 prong to the 3 prong to the cane. I mean, we take for granted just walking down to the mailbox, and you remember the different kind of cane, different kind of tool that you had to use to learn how to walk again.
Yes,
That is
yes,
an amazing story. And I hope this will encourage the people that are out there watching who perhaps are going through that process right now as a brand new survivor or a new survivor that's maybe currently using a 3 prong instead of a 4 prong, that there is hope,
yes,
and it doesn't matter what age you are at. Do you
yes.
mind?
I forgot to mention I was 62 years old when this event occurred, and I'm 64 and a half right now.
Okay, okay. So it doesn't matter how old you are, it can still happen. You
Yes,
can still recover. Um,
yes.
so just clarification, because when you just mentioned this, it's almost unbelievable to me. You were in surgery for 2 days. Your chest was open for 2 days.
Yes,
Wow.
yes. And actually, during that time, my heart stopped for about 7 or 8 minutes, and they had to resuscitate me. Unfortunately, they were able to do that.
Mm-hmm.
Um, I won't go into this because I think sometimes it's because it's different for people. People have gone into when you're in an induced coma, and I forgot to say that my body was also frozen to 25 degrees centigrade.
Okay.
And so it was just like you know, being in a morgue, being in a, I was just barely, my brain activity level was just barely above flatline. That whole time I was in such a deep coma. And that's why, the surgical staff, the cardiologists at Queen Mary Hospital that were in charge of my case, could not assure my daughters and my friend who had contacted my daughters here to bring them here that I would come out of it, and they were very concerned that even if I came out of it, I would have showed the same symptoms of somebody having had a very serious stroke.
Mm-hmm.
And so it really was an amazing recovery to come out of it with all of the obstacles that I had to face in the whole process.
Wow. So after they repaired you, okay. So the repair, because we're all different. All the survivors are different. It sounds like you had a rupture and dissection, or tell us like physically what happened. Was there a rupture? It sounds like you did, and then is there an existing dissection that you have right now?
Well, this is part of the problem here in Hong Kong, Peter, is the fact that they really don't tell you anything, and I have sought to go over. I wanted to see they have e-records of everything, but because this is a public health system, and their time is so limited with patients that it's everything is summarized, clinically summarized. And I just have to kind of guess based on bits and pieces of what actually happened. I do believe you're right that initially it was a rupture that led to the dissection state. So it's interesting that one of the arteries that is I'm not sure because I haven't examined the anatomy. Blood vessel system that closely, and I'm not a professional, but apparently there was an artery that went off of the from the thoracic that goes up towards the back,
Mm-hmm.
and there was a smaller tear there, another rupture.
Okay.
And they did a CAT scan on that about 6 months later, and I didn't even know about this, but they told me that about this and that I might have to have another surgery to repair that rupture. And they found from the CAT scan that it had fused together, and they couldn't understand it. Now, I since then have talked to other cardiologists that have said that sometimes this does happen. It's not medically impossible, but it is extremely rare. And then only recently did I find out that the tear, the rupture, had started from the abdominal region and went up towards the heart. So it wasn't down.
Wow.
From the heart going down, but up. And it went, it got as close to between 0.25 and 0.5 centimeters to where it would have killed me. Apparently, that close to the heart, to the aortic valve.
Oh my.
So that was just information that I got just within the last couple months. So I'm only getting bits and pieces, and I don't have a complete picture. This is part of the frustration of being in this kind of a health system. Although the surgery itself, all I can do is applaud the team, my actual surgeon and the follow-up team and the surgeon who sewed me back up. The scar is very clean, hardly even noticeable. They just did an excellent job. But after 7 weeks in the hospital, one of the weeks I was in the gerontology ward at Ruttengy, and I had people dying all around me during that time. And, when you're recovering from something like an aortic dissection and you're surrounded by people, and the people in the bed next to you die in the middle of the night, and you're the first person to discover and you have to call the nurse.
Oh my.
This is part of my experience of staying in the hospital as a result of an aortic dissection. But anyway, that's just a little bit of extra trivia for my.
Oh my goodness, that must have been scary to deal with. My goodness.
Yeah, it was a bit. Yeah. But, I felt like, and something that I want to say to you new recoverers. I mean, when you're in a hospital setting, everybody's in a different kind of hospital under different kinds of care, but you're going to see other sickness. You may even hear of people or see people die in ICU, even though they may do everything they can to be discreet. You may come into some kind of knowledge of that, but don't let those kinds of phenomena affect your will to live and believe that you're going to recover. And I think that sense of, I have to add that for me there's a religious or spiritual component to my that gave me the basis for really having confidence and perseverance. And my occupational physiotherapist or occupational therapist said that she has worked with aortic dissection people. She never saw anybody recover so fast in the rehab process just because she saw that I had this faith. And that was a very important thing for me. So whatever, you have to give you that incentive and to stimulate you and encourage you to keep believing and keep working towards full recovery. That's very important to have that.
Yes. Yes. Wow. Well, that was definitely very encouraging to hear your story. Really incredible. Um, and congratulations for recovering so well. And spending this time with us to share your story. I think your encouragement to the new survivors also gives them hope. And all I can say is we wish you continue improvement and success. And well, I guess one last question, because you did cover how what you would like to tell the new survivors. Um, What? Oh, gosh. Now I all of a sudden forgot what my last question is. Our pump heads, right? Um, I suppose it would be if there was something that you want to leave, or finish this interview with. What would that be to either survivors or people who's never heard of aortic dissection? What would you like to say to them as a closing?
Well, first of all, I think the most important thing to say is if you have somebody in your family that has experienced an aortic rupture, dissection, aneurysm, whether it's type A, type B, etc., I think it's very important that if there's somebody in your family history that's had that experience, and for me, I've had both genetically and because maybe in my younger years I wasn't very responsible in terms of my weight and eating good foods and getting a sufficient amount of exercise. So I've had hypertension and high blood pressure for many years and had been on blood pressure medications. I think this is if anybody is in these kind of circumstances, I think you should not only check out your heart, but also make sure that through a CAT scan or an MRI that you have your aorta checked as well.
Yes.
Because if you have a history, whether it's genetically related or environmentally, lifestyle related, or a combination of both, which is in my case because my mother's family had a history of heart problems. Okay. I had my grandfather on my mom's side and my uncle, two uncles, all died at a relatively young age of heart-related diseases. And it may have been an aortic dissection, but in those days it wasn't known so much. Right. So check it out. Not only your heart, but your aorta.
Yes.
And especially since blood pressure is such a vital component to keeping you from getting an aortal aneurysm or dissection, rupture, you want to keep doing the right things to keep your blood pressure within the normal range. Normal range, excuse me.
Yes.
So that's what I would like to share with everybody.
Okay. Well, thank you, Cary, again for your time all the way in Hong Kong. I'm glad we had this opportunity to chat, and we hope you watchers out there will be encouraged by Cary's story. And again, all you new survivors out there, there is hope. You just keep getting stronger. And to the people that have never heard of aortic dissection, our public campaign for Aortic Warriors is not just your heart, check your aorta too. And thank you for watching.